Good afternoon, everyone. My name is Rupali Thorat, and my today's topic is minimum criteria for reporting. Pharmacovigilance is a play a vital role in maintaining drug safety after medicine are approval unavailable for use by the public. Even though medicine are carefully tested before marketing, some adverse effects or reaction only become visible when the drug is used by large population. Meaning of the reporting in pharmacovigilance. In pharmacovigilance, reporting refers to the collection, documentation, and communication of information related to the adverse drug reaction, medication error, lack of efficacy of a drug, overdose, misuse, drug interaction. The information collected through reporting helps to detect new safety signals, evaluate drug risks versus benefits, and take regulatory action such as label update, warnings, or even withdrawal of unsafe medicine. Purpose of minimum criteria. The main aim of selecting minimum criteria is to ensure that the report contains enough information confirm that is about a real individual and a real event. Allow investigator to assess causality, make it possible for follow-up if more information is needed, help regulatory authorities to analyze pattern and trends. The four minimum criteria for reporting. Every barrel individual case safety report must contain four essential elements. That first one, an an identifiable patient. The report must refer to as specific identifiable patient who experienced the adverse event. It is not mandatory to give the patient full name and privacy reasons, but some identifying information is necessary to show that the case referred to is a real single person. Example of identifiable information: patient initials or registration initials or registration number, gender, age or age group, date of birth, weight or height. Second is an identifiable reporters. There must be a recognizable individual or organization who has reported the event. Who can be a reporter? Health professional, doctor, nurse, pharmacist, dentist, patient or consumer, clinical investigator, company representative, relative or caregiver. Required information: name, profession, contact details, country of origin. Why it is important? Allow authorities to verify the authenticity of the report. Enable follow-up communication for clarification or missing details. Third is suspect drug or medicinal product. The report must identify which drug or product is suspectable su- su- suspected to have caused the reaction. Without knowing the suspect drug, there is no way to assess or prevent the reaction in the future. Essential information: brand name or generic name of the drug, manufacturer or company name, batch number, dosage form, strength, dose and frequency, route of administration, indications, start and stop date. Why it is important? To establish a temporal relationship between drug drug use and advance event, helps to identify pattern, specific batch, enable regulatory action such as recalls or label changes if necessary. Fourth is an adverse event or reaction. The report must be described at least one adverse event or an undesirable medical occurrence that happened after taking the drug. What is an adverse event? An adverse event is any upwards medical occurrence that happen after using a drug, whether or not it is causally related to the treatment. Details to include description of the event, for example, rashes, vomiting, headache, etc. Onset, date, and duration. Outcomes, seriousness, medical confirmation. Why it is important? Helps to causality assessment, determine the seriousness and impact of the reaction, guide decision making on whether to continue modifying or withdraw of the drug. Thank you.